Pfizer and BioNTech are pledging to provide 1 billion doses of their COVID-19 vaccine to low and middle-income countries by the end of 2021. The Director, National Primary Healthcare Development Agency, at a press briefing in Abuja, says they are also providing another 1 billion doses in 2022. Dr. Faisal Shuaib explains that many African countries are facing challenges in getting the vaccines, and Nigeria is not sure when it will get the next vaccines.
Johnson & Johnson also announced it has signed a deal to provide 200 million doses of its vaccine to COVAX. Separately, the International Monetary Fund is now advocating for a $50 billion fund to be spent on ensuring a faster rollout of COVID-19 vaccines globally, and is calling for at least 40% of the global population to be vaccinated by the end of this year, and at least 60% by June 2022. The fund will be used to increase COVAX vaccine coverage, procure additional tests, and expand vaccine production capacity.
So once again, I would encourage everyone to participate. For those who have taken the first dose, to ensure that they take their second dose in a timely fashion. There isn't much time. Get down there. You can be vaccinated at anywhere, and make sure you get your card stamped and your QR entered into the system. But in the meantime, for all others, is to wait for your turn to be vaccinated and take the steps to protect yourself, your family, and your community.
And for more COVID-19 updates, especially regarding the vaccination of our World Pan-African Virtual Panel discussion, which held on Wednesday, we're joined now by Dr. Mdudu Dube and Anna Zakowicz. Good to have you both. I'm sure I didn't pronounce your names properly. Good to have you, though.
Thank you.
Okay.
Thank you for the invitation.
Okay, great. Now, we're used to hearing the expression, if everyone isn't safe, then no one is safe. Is it that we've gotten immune, as it were, to that expression, or that even those people who endorse that message don't buy into it? Because we tend to see a different kind of trend with regards to vaccine nationalism, as opposed to the message being touted. I put that to Anna, if you could kick us off, please.
Yes. AIDS Healthcare Foundation is an organization that serves in HIV care. We've been working in HIV care for 35 years. And we've seen through HIV pandemic, because COVID pandemic is not the first one, we've seen that through the HIV pandemic, access to treatment or lack of access to treatment impacted negatively on the number of cases that we had around the world. Right now, we have 38 million people who live with HIV, and 33 million people died because of similar problems that we have right now with vaccination. And because of the fact that we need to have equity in access to vaccination, but not only vaccination, also treatment and testing for COVID, we are launching the VOW, Vaccinate Our World campaign, and where we are talking really about equity and financial commitment. And we hear that there is more financial commitments, and also through COVAX right now from pharmaceutical companies, but there is not enough. We need also to have a question of waiving the patent address and knowledge transfer addressed, sharing the information, transparency, but also international cooperation. And we know that across the world, we have big discrepancies. We have countries that covered with vaccination 70% of population, and we have countries that are below 1%. So this is not right. And if we live in the global world, and if we are to live in the global world, we need to address the inequalities in access.
Sorry, Anna, if you don't mind my asking, I just want to find out, why do you think this is? Why are we still seeing vaccine inequities in spite of the fact that the message is clear enough?
we have richer countries with technologies, which much more money to invest in vaccine. So some countries, European Union was able to invest in building the potential. Other countries need support, and that's why we are talking about transferring the knowledge, building sufficient capacity for now to address COVID crisis, but also for the future.
All right, Dr. Nduduzo, let me bring it to you. The situation Anna paints is what the WHO chief describes as scandalous inequity, where 75% of all available vaccines is said to have been carried out in only 10 countries. But she also mentioned waiving intellectual property rights. Is this a reasonable ask, given that there is more to vaccine production and vaccine distribution than patents?
I would say the COVID-19 pandemic has taught us that we are one global unit, and we have to put aside politics and profit making and consider saving the world. I mean, this is the time where we have to let science lead us, not politics and not economics or anything like that. Because if we don't protect, or if we don't protect the rest of the world and we allow the virus to continue being transmitted, no one is going to be safe. So all these countries that feel like that the borders can protect them, I mean, we should have learned from HIV/AIDS that the borders don't protect us. The race, the socioeconomic classes don't protect us. So what we need to do as a world, we need to support each other. The pharmaceutical companies should not only consider profit, and they should just consider humanity and make sure that everyone is safe. Because even if these few countries that are vaccinated remain vaccinated, as long as the virus is replicating in other countries, they will still get resistant strains that will come to and attack them. So we should have learned from HIV/AIDS and Ebola that if the rest of the world is not protected, no one is safe, no matter how much money you have or how much vaccination you can do in your own country.
Yes, but the debate is that it takes much more than waiving intellectual property right to have more vaccines produced and distributed across the world, especially for the low and middle income countries. So that's why I ask, is it a reasonable ask to have patent waivers? Is that a solution? Or just one of the solutions? That's what I'm asking.
It's not the only solution. We still have to raise money. I mean, at the end of the day, it's not about getting the vaccines alone. It's also about the logistics of actually distributing the vaccines, administering the vaccines to the people. So it's not just about waiving the patents. It's all about coming together, because at the end of the day, the pharmaceutical companies still have to make profit. So as the world, we need to also mobilize resources. I mean, this is the time where we have to consider the 15% allocation for health, budget for health in our countries as well. We are appealing to everyone, even monetary funds, International Monetary Fund, Global Fund, to also contribute. Even individual countries, they also have to be seen coming forward to also garner resources so that they contribute towards buying these vaccines for the poor. So it's not about just patents, but patents is just one of them, because we need to allow production at a lower cost and at a larger scale so that we can satisfy the need that is current today.
Okay, Anna, Nduduzo says we should let science lead us. And your bureau chief says that the war against COVID-19 could use research facilities already available in Africa, and that would help with real-time action today. Can you give us a sense of how practical that suggestion is? Have you begun to embark on this recommendation?
Mm-hmm. We strongly believe that that vaccine should be produced where the need is, right? And for this, there is a need for capacity, right? Building, but also building the infrastructure. And where the infrastructure is present there, and there is capacity to produce vaccination, this could be used. It is the case of some African countries, but this is a case of Brazil, Argentina. So I think it's about looking and seeing what is the capacity right now, but also I think we need to think about the future and really build the capacity further. And I think the WHO initiative on RNA vaccine technology transfer hub, I think this is one of the initiatives to support this in short term to of course address the COVID issue, but then establish sufficient local capacity which needs to be built.
And Dr. Nduduzo, tell us about this ambitious campaign to vaccinate our world campaign. How realistic is this? And would you say history is repeating itself given what we went through with the HIV and AIDS pandemic?
Yeah, the campaign might look ambitious, but if you look at the fact that we're appealing to everyone, basically, we're appealing to world leaders, we are appealing to global health initiatives, we're appealing to the corporate world, we're appealing to everyone to come together, basically, to raise enough resources and allocate these resources to making sure that people are vaccinated. Because the other thing that we have to notice is that the COVID-19 pandemic affects economic activity. So even if you don't contribute to this and borders are closed, travel is closed, and trade is also affected, you're not going to benefit anything. But if you contribute the little that you can contribute and garner enough resources so that we can at least pay the pharmaceutical companies, and also we can also be able to appeal to them to release the patents and franchise and allow production to be done in other zones where the vaccine is most needed, then we will be able to get it. So we are appealing to everyone who can contribute, civil society, corporate world, governments, to make sure that they mobilize resources towards vaccinating the world. So it is very possible as long as we agree or we accept that we are now one global unit. No one is better than the other. No one is safer as long as the virus is still propagating or is still being transmitted somewhere else. So we need to garner all these resources.
Okay, well, thank you, Nduduzo, Doctor, and thank you, Anna, for your insights.